dramatically more powerful for longevity and disease preventions than current guidelines suggest.
Yeah.
Usual rule is 1 minute of vigorous equals 2 minutes of moderate. It's more like 1 minute of vigorous equals 4 to 9 minutes of moderate.
Yeah. She's big on like exercise snacks and doing.
Yeah.
I think she talks about Tabatas a little bit, but Tabatas are one of my go-to favorite ones, and it's really the only thing I can do right now for cardio.
Yeah.
We're just on the sprinter with just legs, no arms.
Yeah.
But yeah. All right. Well, we're recording, so I'll edit out and get everything squared away. But I have to like start the recording and the camera at the same time, and my timer to make sure the battery's not dead. So I know why there's like paid people that do this, but we'll figure it out. All right. We're live.
Give me the lowdown on test.
Are you logged in?
What's the passcode?
Can't say that over the air, dude. Uh-oh. There we go. All right, lowdown on test. Well, I kind of want to preface with I think that it's beneficial for men and women. I don't think, I know for sure. I think a lot of people have a stigma against like what testosterone is, and flat out, it is a anabolic steroid hormone in the body. And from that comes a lot of benefit. But I will say, I think just like many other things in the health and wellness industry and supplement industry, it gets exploited to the fact of people get scared and think they need to be on it, and or given a pretty low quality product. And especially with these clinics that you don't even have to talk to anybody anymore. So I think some of them you can just fill out a questionnaire and they'll send you the $90 a month testosterone. I'd like to touch on that like later when we're talking about carrier oils and stuff like that. Because I've talked to a few doctors about that specifically. But either way, it's a hormone in the body, extremely beneficial for mood, extremely beneficial for muscle protein synthesis. I think that's probably the most well-known the anabolic effect it has in the body. And yeah, it's a great hormone. So I think people should not be afraid of it, but also educate themselves before they just decide to jump on it.
So you mentioned like the one-stop shops. I'm not going to name names, but there's places where you can essentially just like punch in, I'm feeling XYZ, you talk virtually to a doctor, and then they'll essentially prescribe it online right there. I
Yeah.
think as a concept, right? I never
Right.
went through the full like funnel of those companies. I've went through them though, and I'm pretty confident you can just go and get it, right?
Yeah, pretty much.
But the right way to do it though is a panel. But you were telling me like off air that a lot of like good doctors are prescribing off feel.
Yeah, I wouldn't say feel well, I
Like
guess
a mix of blood work
right.
and feel, right?
I would suggest that if you have interest in it, it's always good to have a blood panel. And we'll dive into that too of like what's excessive for blood panels. Do you actually need them? I
Yeah.
think at baseline, it's great for every individual, men and women, to get a decently in-depth panel. One, to see, depending on stage of life, we're 30s. I think for me, my biggest thing would be like, I want to know a foundational baseline of hormones, hemoglobin A1C, lipid markers, all these things, so that in the future, if things start to go up or down, or I start to see more or less of symptoms, I can have a somewhat idea of where I was, quote unquote, peak, 20s, 30s, late 20s, 30s. And I think it's especially important for our parents' generation, like the generation that's 50s, 60s, and especially above, but very important for peri and postmenopausal women to understand those hormones better before they get put on levothyroxine and osteoporosis medications and all these other things that come with that. And then, prediabetes is pretty rampant in our society, and that's a whole nother podcast, but it's not necessarily like I don't like the alpha bro mentality of just like just be disciplined and lose weight, because we've done such a poor job of educating people of what truly food does in the body that people, according to their education and their eating habits, are they're not going to make progress if they're eating certain things, specifically with blood glucose levels. That's a big one. But either way, back to kind of test. I would say if you're interested, and it depends on your goals, like if you care about having kids, infertility is definitely affected. And if your goal is to get yourself uh, a more vital lifestyle, yeah, testosterone has a place. I'd say get a decent panel to have a baseline of where you're at. And then from there, depending on the provider, there's a one guy I want to mention, Dr. Jordan Grant. Should definitely watch his videos. I met him at a health summit and I really enjoyed and appreciated his perspective on all this. He was a urologist practicing in regular, hospital, left there and started doing his own clinic specifically. And his wife was a urologist, so she does female hormones and he does the male hormones. But his perspective was very much, hey, let's not get into crazy amounts of blood panels. If you're specifically talking about you want TRT, let's get the ones we need that we know are beneficial and the ones we want to look at throughout the process. But once you kind of get into the process, he bases dosages and prescriptions, from my understanding, more off of symptomatic response and how your body's reacting because everybody's different. There's a factor of like androgen receptors on the cell where your 300 might be different than my 300. People, it's a big one too that people don't realize is like you and I are over 200 pounds. 300 nanograms per deciliter in a 200-pound man is different than 300 nanograms per deciliter in a 150-pound male, right? Muscle mass plays a role. And then it comes down to genetics, which we don't have a measurement of how to do this, but it would be measuring androgen receptors on the cell, which are the lock and key for testosterone, androgen to come in and affect that cell, which I'd like to dive into of how it affects muscle protein synthesis, dopamine, all those things. So there's a lot of factors to it other than just like, let's just go online and find the Instagram ad, click go, and no one's giving you guidance, which would be I would suggest you find someone that's educated on this, whether it's health coach, which some of them are, man, I met a few of these health coaches that are just insanely knowledgeable to the molecular level on all things health. And then there are some providers too that are very knowledgeable on procedures with it, the methods they use, and also the providers want to utilize health coaches because even in they call it cash or like out of pocket clinics, like a lot of the TRT ones are, the providers still can't give as in depth and continuous knowledge as they want to. You know what I mean? They're still limited to some sense of like how long you only can't spend 2 hours with a client, whereas a health coach, their platform is more friendly to that. They're usually sitting down with the client maybe once a week or more, following up, continuing education, giving recommendations. So they like that aspect too, because it comes into lifestyle of health and sleep and weight training would be a huge one. So,
Yeah. And that's like a Merrick.
Merrick, yeah, I haven't used, I went through them to when I first started diving into blood panels just to see, uh, I wanted to understand it better. And, I haven't used them in like 5 years probably. So I'm not sure where they're at now. But their health coach that I worked with was fairly knowledgeable on blood panels, and then that led to getting a meeting with a provider who's a nurse practitioner, and she was super knowledgeable. And at that point, I'm still not, but I wasn't interested in testosterone replacement. Like I'm not in that stage of my life where I want it yet. I eventually will be for sure because I know all the benefits as we age, but right now it's I'm not interested. And she I appreciated very much that she was like, "Hey, let's look at everything," and she didn't even push it. She was like, "Are you interested?" I'm like, "Nah, not right now, really, because we're a lot of things that go into it." But she's like, "Okay, yeah, I wouldn't recommend it to you anyways," which is something you don't find a lot with these TRT clinics because why they're making money off of you getting
Yeah.
like their end goal is to get you on it, right?
Yeah. That
So I really
recurring revenue rolling.
yeah, that's why I liked Merrick a lot because they weren't pushing anything. They just give I mean, they give a huge list of, like, recommendations and stuff, but they don't say, like, "You need all these." Where, like, another thing, some TRT clinics or, HRT clinics for women, you'll go to them and they'll sell you a bunch of supplements that are essentially some of them do sell like Thorne, right? But they, take a little bit more off the top, so they add a little bit to the price, and then they'll give you a supplement that helps, uh helps uptake of the testosterone or the androgens like estradiol and stuff, but I think those are pretty much that's a $90 B complex multivitamin that's not doing a whole lot. But there are some that I would love to talk about, specifically tadalafil, that has shown it can increase uptake of testosterone. So,
Yeah. Yeah, I want to ask about that. So just like for let's say me in like 3 years.
yeah.
I'm not sure if we're done having kids yet, so I'm not like interested right now. I
Hmm.
am getting my labs done as you recommended to get my baseline here, but I can tell I'm on the decline at 32. Like I don't recover as fast. Libido's definitely lower. Like I can tell I'm going down. So let's say 3 years from now we're done having kids. I'm 35. One of my, I guess, concerns, like I want to live ideally long, but live well throughout those years is like longevity. In like regards to testosterone, is there any fears of the longevity of TRT? And I guess I kind of want to backtrack to what you're talking about with the natural ways. Do you go natural first, try to like maximize your body's natural production through supplementation, obviously diet, sleep, all those things? Do you do that first and then last resort, say at whatever 40, 45, you go to TRT?
I will say I don't think of it as like a last resort. I don't think of it as like try everything you can and then get there. But I will say you should do all the things correctly first before diving into TRT because, in my opinion, I used to be like very like, no, that's testosterone's like cheating or whatever. You should do it, whatever. And then I went through like specifically anatomy and physiology course, and I was like, holy cow, this is like correlated to so many things and it's super interesting. Anyways, there is a way, or there is something to say like max out everything else first. Like alcohol, the recent studies substantially lowers testosterone. So if you're doing it, moderation, I did it for a long time. I can't say don't do it, but it's definitely going to affect it. So be aware of that directly and indirectly through your liver and then sleep. You're not going to get into REM even at the count of like 3 to 4 drinks. People are different. Uh, as far as nutrition goes, that has a huge effect on ATP and the mitochondria. ATP being an energy source for like all things in the body, and that helps the production of testosterone in the body. And then supplementation, like that's something too that I got a question on is like, are these T boosters actually worth it? I would say they might. At the greatest extent, it's like 20 to 30% increase of testosterone, which let's say you're at 500 nanograms per deciliter, which is the typical US measurement of total testosterone, serum testosterone in the blood. You might get a 30% increase to like 600. Are you going to notice a whole lot? Maybe if you're like completely dialed in and you're like, oh, I got a little bump, but that's not going to be a needle mover compared to getting to what they consider optimal levels of a man at like 8 to 900, maybe 1,000 nanograms per deciliter of testosterone. And that's total, not your free and everything else. So I don't know if I answered, but essentially, yes, to get stuff squared away first, like the baseline, easy, like low hanging fruit, get a blood panel so you know once you have all those things locked in, like, are you truly hypogonadal or decreasing in testosterone? And then it
What's hypogonadal?
just meaning your the pituitary like the hypothalamus and the pituitary work in conjunction to create LH, which is the primary hormone that goes down and produces testosterone in the Leydig cells. So if you're hypogonadal, meaning like your hypothalamus is probably not talking correctly, releasing GnRH, and then therefore you're producing like very minimal levels of testosterone. So hypogonadal would be like 200 or less, 100 or less, and sometimes dudes are down in like 50s, which is like incredibly low. So
Got it. Okay.
that's hypogonadal is the term for low T.
Sorry, I
That's the
cut you off. I
no, no,
didn't.
no.
I didn't know you
That's the
referenced that twice. I didn't
yeah,
know what it
yeah.
means.
I
Got it.
should have prefaced. That's hypogonadal would be the medical term for low T.
Got it. Okay.
Should have just said that.
Yeah. Okay. So what was you referenced? Was it a natural way to boost testosterone?
Yeah.
What is that?
The best ways.
No, no, no. You said a ingredient before we got down this path. That's what
Tadalafil?
Tadalafil. Yeah.
Oh, that's Cialis.
Oh, geez. Okay.
So it's not natural, but I would say that is the one prescription that I'm not. There's a lot of good research on it.
Okay. So
But
my understanding of Cialis is it's just like a boner pill.
No, yes.
No?
Well, that's what it was. It was originally it started with Viagra. Viagra was a blood pressure medication. They found out that it helped you get an erection, better at sexual whatever performance. Tadalafil is kind of the cousin to that, and it's more of like a they call it like the weekend pill because at like a 20 milligram dose, you take it and it's good. It stays in your system, has a longer half life. So it stays in your system for 24 to 48 hours. So it's more spontaneous. Like I'm taking it on Thursday, I'm good till Sunday kind of thing.
Oh, nice.
Whereas Viagra is more a way higher 40 milligram, 60 milligram dose. And it's like you take it and like 10 minutes later, you're getting after it. But it's not specific to your penis. It does increase blood flow to that specific muscle in there. But why tadalafil is good at a low dose and why guys like it and why I like it and I will recommend it and I got some prescribed to me at a 5 milligram dose. That's a daily thing is because it's a PDE5 inhibitor, which is an enzyme that breaks down nitric oxide. Nitric oxide, I'm sure you've heard is just a gaseous thing in our vessels that vasodilate and opens them up. So it increases blood flow and circulatory things to the entire body. A lot of research actually coming out on how it increases circulation in the brain, might bring cognitive benefits and less neuroinflammation. So it helps with memory, helps with cognition. It helps with the pump, obviously, in the gym, but that's getting blood and nutrients to your muscles. Muscles consume the most. Muscles have the most vasculature going to them, like blood flowing to them. So to increase that would help muscle growth. And then how it works in conjunction with testosterone is it essentially helps with upregulation at the nuclear level of androgen receptors. So androgen receptors are on every cell. That's what essentially testosterone locks into and binds to, and then does all these things at the cellular level, like muscle protein synthesis, which is essentially just transcribing more amino acids to then produce more proteins to then produce more muscle. You're going to recover faster. You're going to heal faster. They did it studies to increase wound healing after surgeries and tendon healing and stuff. So that's how that kind of works. Tadalafil has shown to increase the amount of androgen receptor sensitivity on the cell.
And you just take it like a couple times a week, or what's the?
I just do 5 milligrams a day. It significantly reduced my blood pressure from being hypertensive from like 145 systolic or above usually to I'm 120 over 80 consistently now.
Wow.
So that's another huge thing because that goes into arterial low sclerosis, which is not to be confused with atherosclerosis. But arterial low sclerosis is just essentially thickening of your vessels, your endothelium, and collagen is what makes up your vessels. Once those thicken, like it's really hard to reverse that, and that's primarily due to high blood pressure. So then would lead to more cardiovascular, could lead higher potential for heart attacks.
And you don't have to like cycle off of this or anything. There's no like long-term concerns.
I would say no. It's always good to, in my opinion, it's always good to cycle off everything. Even if you drink 2 cups of coffee a day, it's good to cycle off it. I'm not even a multivitamin, like give your body a rest from whatever you're putting into it. That's why fasting's good, right?
Yeah.
I'd say primarily if you want to do it 5 days a week,
Got it.
or do it for a month, take a week off. But yeah,
Oh, that's interesting. I guess the original question I had though was, is there anything that's like proven that's natural that you do before? Like I think it's called epinephrine
that's epinephrine.
or epi
Epinephrine is your adrenaline.
no, no, no. What was the one with the E we were talking about? It's a newer drug that allegedly is like naturally boost testosterone.
I
Gosh, I
mean, I
should have
know
had
there's like
this.
Tomcat Ali.
No, I have to
Oh,
look
and
it up. And
clomiphene.
clomiphene.
Okay, so
Yes. Yeah.
that's not natural by any means.
No.
That is a
Okay.
SERM. So it's
Okay.
a similar to SARM. It's a SERM though, and it was originally for like Clomid was the original one for breast cancer in women. Essentially, it's a selective estrogen selective estrogen. I'm blanking now. Selective estrogen something modulator. Receptor modulator. So essentially it binds to estrogen receptors, therefore telling your body like you have more estrogen than you do. And then you will increase the amount of testosterone because they
That's
work in
right.
conjunction. Like
Yeah.
your testosterone aromatizes into estrogen. So when you raise your testosterone, you're going to raise your estrogen. And the aromatase is just an enzyme that converts the two.
But it seems like you're not a believer in like doing that first. Like,
You could, but it's still going to have some sort of an effect. Like it's not going to shut you down, and men like to do it as a precursor to raise their testosterone so they can still have kids and have fertility and
Got
not
it.
have their nuts shrink.
Yeah.
But it's still going to have some effect. And a lot of guys will say that they don't feel like you might raise it, but the method that it's working in the body isn't necessarily like giving you the effects really that
Got
you
it.
would feel. Like if you're doing exogenous testosterone, that's going to be the most extreme effect you're going to feel. Like you're introducing a high level of outside testosterone in your body, so you're definitely going to feel effects.
Got it. And the second part of the question was like longevity.
Mm-hmm.
I feel like I've seen more and more research that kind of debunks that like exogenous testosterone is bad for like heart health.
Yeah,
Thickening the blood, I think, was one that
yeah,
was always
hematocrit
said.
levels.
Yeah.
Yeah, so that's a still pretty heavy topic, but at that summit they specifically talked about how it increases hematocrit levels, and you don't need to bloodlet and go give um, blood all the time because it all comes back to being healthy. Like if you don't have metabolic issues, like you shouldn't have to worry about a high hematocrit.
Mm-hmm.
Um, you should definitely be aware of it if you are kind of already there. But if you're doing the right stuff, if you're resistance training too, like exercising, all that stuff helps. So like longevity wise, it's been studied for, well, the father of endocrinology was a French doctor who originally, I think he ground up like dog testicles and animal testicles and injected this into him and was like, this is great. I have so much more energy. And like, yeah. So that's kind of the start of it, but it's been studied for decades. And longevity wise, I think it's a net benefit for vitality. Like you're going to feel better. You're going to have better cognition. You'll have less soreness. All that to say, like, you have to be doing 80% right by your body first, right? So longevity wise, I think a lot of that has been or is now being more studied since it has less of a stigma and it's becoming more popular, but more and more is saying like, yeah, like it's not going to be a huge issue.
Yeah. One of the fears I guess people have, and I personally have, is like pinning myself for the
Yeah.
rest of my life.
Hmm.
You were telling me that Dr. Grant,
Hmm.
he does all creams, right? So
Big fan of
that's,
that. Yeah.
yeah. You just rub some cream on your arm and
Yeah. I say that's a big one with people is pinning. Like anything else, you probably get used to it. It's not
yeah.
that bad. But yeah, there's different methods too as far as like esters, like cypionate's the most popular in the US, and undecanate is a longer ester that's more popular in Europe. But essentially, the every 5 days you'd be pinning for the testosterone if you're using a cypionate. And yeah, that just kind of some people hate it, and that's why they come off it. But the pellets is another one that is coming more popular now, and it all depends. Like honestly, what clinic you're going to. Like if you go into a clinic that primarily does pellets, they're going to preach to you why pellets are the best. Like
Right.
it's what it comes down to is what you can make work in your life, and then what you're comfortable with. But the pellets are essentially it's bioidentical hormone and it metabolizes. So they'll put like, hey, your levels are at this, you're this weight. They do a calculation, they figure out this many pellets, and it'll last about 4 to 6 months, and they'll metabolize kind of like one at a time, we'll say. But if you ramp up your metabolism by working out a lot or going through a lot of stress, they might go quicker. And then guys don't necessarily like that because, like, one, you can't, like, it's in there. Your pellets are in there. You can't change anything. So if you're like skyrocketing and you're a hyper responder, let's say, and even 900 nanograms per deciliter, like you start to get acne and whatever, or sensitive nipples is a common one. But I'd say if you are doing pellets like out of convenience because you're traveling a lot, perhaps, but that's one to be aware of like a big issue. And then a lot of guys see like a big fall off. So like when your pellets run out, you get this crazy
Mhm.
crash and you like got to get them in right away again.
Yeah.
So
And they have no way of monitoring.
the way they would like the
Like you drop the pellet in and it's like, how do you monitor?
blood panels would be the only way.
Yeah,
Typically
that's
they
a
want to
pain in
do
the
one like
ass.
6 weeks. I think it's like 6 weeks after they put them in, they want to do one. And then, yeah, everyone's a little different.
It sounds convenient, but not
Yeah.
the best way.
Yeah. It'd be more of like you have a lifestyle that, like for older men, it might be like an older retired male that might be perfect because you throw them in, don't have to worry about them. You figure out your dosing. And then let's say it's every 4 months, you just go back in and do it. And you
Yeah.
can, if you're retired and you don't have a crazy schedule and you're not like going on trips and not traveling for work or whatever, uh, yeah, you can plan, so
Yeah.
that you're not having that crash. But real quick, I got to check, make sure our battery's good on the camera. And then I'll talk about the next. Oh, yeah. Golden. So I was kind of back and forth about creams for a while just because a lot of guys said they didn't like it. Like you need a large dose. So the best, like androgel is a popular one, but I would say the gels are kind of not great for absorption. It'd be like a compounding cream that you get from a reliable compounding pharmacy through a reliable provider. But Dr. Grant was big on the creams. He really likes them.
Where does he
Convenience.
get his?
He goes through, I would imagine he goes through a compounding pharmacy.
Got it. Is he do remote or is he only in
Yeah.
person?
He for him, like Texas, he's based out of Texas, so he does remote. And I think if you're out of state, you have to go at least once to do a consultation or something.
Got it. Okay.
But he's a big fan of creams because he can adjust very easily with a cream.
Right.
So yeah, you either do a smaller dab, a smaller concentration. Typically it's morning and evening that you do it, and you apply it on the scrotum because the scrotum is super thin skin and it has a massive amount of capillaries in there, so it absorbs into the blood rather quickly. And it's not like a, it's not your shoulders, it's not your thighs, like it's pretty private area where you're not gonna like hopefully be rubbing it on much. But yeah, he was a fan of using that in his patients because he loves to go off of like, hey, like is this working? Is it not working? let's talk about symptoms
Mhm.
after the initial panels. Yeah.
Yeah, and then you could be like, do
What's up, everyone? Don't worry, this isn't an ad for Athletic Greens. Due to my lack of technology knowledge, the video cuts out at about 30 minutes. There's still 30 more minutes of the episode. So if you'd like to go in depth a little bit more, read the article I wrote on solutionstowellness.org for TRT specifically. There's going to be a lot of good panels in there, numbers you want to look at, some more things that we didn't get a chance to dive into, and some good info. So go check that out. Thanks.
X amount more
Yep.
this week,
Right.
rather than like 4 months with a pellet or whatever it may
Yeah.
be.
Yeah. So that's why pellets, I would say, are probably last on my list, especially for women.
So what's first right now? Cream?
It's man, it would just depend. Like if I were to start, I think creams are a good start. Introduction. I'd say creams are a great introduction, especially if you have concerns with injections. And it's less, the feeling of you're doing some crazy lab experiment in your bathroom, which you're not, but some people it's daunting. Yeah. So I think creams are probably the best introduction, and then tailoring it is going to be fairly easy.
Yeah.
And then there is a pill now called Kysotrex, and I've done a little research on it, but I think the biggest thing with that, and I think that's a once a day pill, and it's supposed to not be liver. It's not like hepatotoxic and like hard on the liver, but I think the dosing isn't quite there yet, according to some people. So it's not quite to the tune of what they like, but I would imagine within the next several years, it's probably all going to transition to like a pill or patch.
Right.
Something
It'll
like
only
that.
become more convenient.
Yeah.
Right. Yeah, it's exciting. What about, like, ideally, if you could have just like the perfect stack for the rest of your life, would HCG be included in that? Like, do you want to keep your own production, or is it like, does it not matter after you're done having kids?
Yeah, that's a really good question. So HCG is human chorionic gonadotropin, which is essentially in men when you're doing it in conjunction with TRT, it's to mimic luteinizing hormone so that the testicles don't shut down and atrophy, and therefore you still have the ability to conceive and you don't lose your nuts. So that would just depend on like if you're 60 years old and don't care about your nuts shrinking and you know you're not gonna have kids, or even at 40, uh, I would say that it's not gonna be a huge game changer other than that, because uh it's expensive. So yeah, that adds a hefty price tag to your monthly routine or whatnot.
So there's no like bad side effects if your nuts shut down, as long as you have the exogenous testosterone. Like in my mind, I'm just like, how like that's got to mess something up, but I
Well,
don't know.
in essence, yes, but the main reason your testicles are shrinking, atrophy, is because like they're not needed. So just like muscles, like if you don't use your muscles, they're going to shrink. That's how the body's always trying to conserve energy. That's why our brain's always trying to find the cheat code to take the shortest route to things. And that's why so many people love supplements, and why it's just like, how do I get the quick, so yeah, your nuts are gonna shrink. That's just the body's response of like, I don't need to do this, so they're not really needed. And that's going to also kind of shut off your Sertoli cells, which are the primary cells in spermatogenesis. Therefore, you're not going to have zero, but you're going to have like next to none sperm production, and that's something to think about. And I will say too, because the question comes like, okay, what if I decide I want to go on it at, I don't know, a younger age or something, and then all of a sudden you meet the love of your life, and you want kids, right? Coming off it, utilizing HCG is typically what guys do, if they aren't taking HCG alongside the whole time. But most guys do recover. I was reading some research papers that said within 6 months, you're back at like 80%, depending on the dosage, depending on the time you're on. Like, it's going to be way different if you're doing it for 2 years versus 15. And then up to 24 months to get back to like 100% where you would be normally.
That's with HCG?
That's with if you're not taking HCG and you're just going straight testosterone, then just come off it. If you take HCG with testosterone, there's, I don't want to say no rebound, but there's almost, it mitigates it heavily of like coming off the testosterone, and then you just continue to take HCG for several weeks, and then that helps kind of bridge that gap.
Got it. Okay.
Yeah. And your nuts will not really, there won't be much change in size if you're doing HCG alongside of it while you're taking TRT.
Got it. Okay.
And clomiphene, Clomid's another, they utilize that as well.
Coming off and
during. So sometimes instead of taking HCG, guys will take Clomid, and that preserves their testicles and their fertility. So the thing I will say with that is, from my research, Clomid, there's not a lot of long-term studies in men in conjunction with that, and some people do have side effects. So specifically vision was a big one, which is kind of nerve-wracking.
Right.
Yeah. So
if you like seeing things.
Yeah. It's a big deal.
Huh. Yeah. So I don't want to like blanket statement like everyone should be on test at X, Y, Z age, because it's all like, 55-year-old could have great levels and great energy.
Yeah.
But probably like majority of older men, older women, like you said, postmenopausal, don't. So I guess for the people that don't have high energy levels and they feel like crap and they have, the markers that would imply that they could benefit from this, like should be a thing.
It's worth looking into. So in older men, we see what's called andropause. It's like the male version of menopause. And essentially,
when does this happen? Roughly.
Yeah. So they say that after age 30-ish, you start getting a 1% decrease in testosterone production, and also a lot of other things like growth hormone, a lot of things. We're outliving like our normal biometrics, I guess. Side note, my wife and I went to a cemetery, and the oldest person headstone was like 35, and this is like a cemetery that we found just to go see, and it was like in the 1800s or something. So like we're way out surpassing our natural living. So that's why we see an uptake in a lot of chronic disease on top of bad living. But there's a lot of factors too now with like polyfluoroalkyl substances or PFAS, plastics, phthalates, all these things that bind to receptors that mimic estrogen and lower testosterone faster. Age plays a role because your Leydig cells, that are the cells that uptake LH and then therefore produce testosterone, those are becoming less, they're desensitizing. So they become less effective. So that's why you see a major decline in 50s, 60s and above. So around age 30, it starts declining, not with everybody. And then as you age, you're just becoming less efficient at pretty much everything, but specifically to testosterone as well. And men would undoubtedly, more likely than not, see a difference if they got on it. And women are effectively not making hormones after menopause. They're still making LH and FSH, but they don't have follicles in their ovaries anymore. So they're not producing testosterone and estrogen, that's their gonad, their primary area. So
they'd heavily benefit.
Women, yes.
Yeah.
Specifically with mood, and we should talk about how it affects dopamine. But a big one in women is osteoporosis, which is just breaking down of the bones. They're 4 times more likely to fracture a hip, and it's like a 90% chance that you're not going to rebound from a broken hip at a certain age, because estrogen has a direct correlation with osteoclasts and osteoblasts and bone density. And then testosterone for mood, libido, just vitality, and then sarcopenia, which is muscle wasting. You know, they're going to lose everything a lot quicker when you don't have hormones.
How does testosterone affect dopamine?
So dopamine is our motivation neurotransmitter, right? That's like the let's go get it, get after it. And it is a direct correlation to synthesis of dopamine and then the receptors of dopamine. So it increases the production of it and increases your brain's sensitivity to dopamine. So you have more and you utilize it better when you have a better sensitivity. So that's why in puberty, young men, teen years, have a skyrocketing testosterone, a skyrocketing DHT, which is a form of testosterone, a higher level of androgen. So it's 2 to 5 times more powerful than testosterone itself. But their dopamine levels are like skyrocket. That's like why young men will go towards like the end of the earth to get what they want, like a girl's number or something. And so that's another good point of there is a case for like, we talked about having your lifestyle kind of squared away first. There's a lot of instances of guys that are out of shape, not going to the gym, just like maybe they're drinking, but they just, don't have motivation to do stuff. They get on TRT and it's like life changing because now they have energy. Now they're not tired and sore and in pain all the time. And they have that drive. So there's an aspect of that too, of like some guys get on it without doing the, extreme lifestyle changes or whatever. And it's super beneficial to them. So, but yeah. And then, so again, testosterone rises, aromatizes into estrogen. Estrogen has a direct, similar to testosterone on dopamine, has the same thing with serotonin. So estrogen is the synthesizer, not the, but a synthesizer in serotonin production via tryptophan. We talked about that, the amino acid. So it helps turn tryptophan into serotonin. So think of like dopamine, it's like gets you there, motivation, and then serotonin is the mood hormone to kind of like keep you there, right? And what we see in lower testosterone, therefore lower estrogen, is you get more moody and stuff like that. And I would say that the roid rage stuff, that comes from like super physiological amounts of testosterone. And then in conjunction, a lot of guys that are doing that take an aromatase inhibitor, which then crashes their their estradiol. Therefore, you have this huge increase of testosterone. You crush your estrogen with an aromatase inhibitor, you're going to be super moody. So that was another thing that Dr. Grant is very adamant on. He's got some good videos of don't take it. He's very not okay with aromatase inhibitors. So,
Interesting.
which is a very popular thing that clinics will put guys on in conjunction with TRT.
So is like the most common just a cream then?
For the
Just like a standard patient. I know everyone's going to be different, but
cream for testosterone?
yeah. Like if I go see Dr. Grant and
Yeah. I would say I think most clinics are injections.
right, but it's just testosterone typically.
Oh,
like they're not adding on, this to balance this and this to balance that.
I'd say more often than not, they give an AI with it, an aromatase inhibitor, which I would not.
You wouldn't do.
No.
Yeah.
Because
you just do test by itself.
Well, it would depend on if you're very responsive, you might get an increase in estrogen. Also, estrogen gets aromatized in fat cells. So the more fat you have, if you increase testosterone, you're therefore going to increase estrogen. So if you're overweight, you're definitely going to increase estrogen levels. And that's why in obese people, you see a lot more estrogen and lower testosterone, because adipose tissue, your fat, is like where estrogen essentially does really well. Let's say like it's like a perfect storm. So if you take an aromatase inhibitor, you're going to crash, or potentially going to crash, your estradiol. And if you're in like single digits as a male, that's not good. A lot of guys get on it because they get fear of gynecomastia and they have extreme nipple sensitivity when they're taking TRT. So they immediately go to an aromatase inhibitor. The reason you see nipple sensitivity is because the nipples, it's a mammary gland. Nipples have a high receptor of estrogen, and like the nerves in there are very sensitive to estrogen. So if you increase that, you might get nipple sensitivity. Although some providers like to just kind of just like let that be. You know what I mean? Like they don't want to just immediately get on an AI. Like that's just part of it. And your body, your body's like kind of like, what the heck's going on if you start deucing tests? So it's typically too, it takes like 4 to 12 weeks for your body to like figure everything out. So you might just have to give it a few weeks and then that nipple sensitivity will go away. And the gyno is more, I shouldn't say more. The gyno is, it's not like fat around, it's like legitimately hard rubbery breast tissue. And what happens is estrogen increases vascularity in there, um, fueling kind of that tissue building. And then prolactin is one thing that's never really looked at in panels, but in men. But that prolactin then kind of like is what produces more breast tissue. So estrogen's kind of like the fertilizer, and then prolactin comes in and creates that, that final kind of stage of it. So potentially looking at an inhibitor of prolactin if you're having some like serious gyno. And a lot of times too, if it's just small amounts, people do see it reduce if they either come off or do end up on an aromatase inhibitor or DIM. DIM is like I'd say DIM before an aromatase inhibitor because it doesn't crash aromatase. It affects estrogen by it synthesizing quicker in the body. So it just cycles up estrogen usage faster. So it's more of a supplement than a direct, whatever. So sometimes you get on a DIM and that will help just relieve some of those high estrogen levels without crashing at single digits.
Huh. Interesting.
Yeah,
That's a lot.
And so I will say too, estrogen is important in men and women. It has a direct correlation with joint health, mood, but joint health specifically, it's a kind of a precursor for hyaluronic acid, and that's what you find in synovial fluid in the joints. Essentially, hyaluronic acid is a saccharide, which is just a science word for sugar, and sugar is extremely osmotic to water. So it pulls water with it, and that's why it's in the synovial fluid. So if you take that out of there, you're going to dry out your joints, dry out your skin. And that's why a lot of women post-menopause get like really dry skin. It's definitely causing more wrinkles. And so people who actually get prescribed hyaluronic acid in a face moisturizer because it draws all that water and moisture to help the skin. And then if you're a male and you're on aromatase inhibitor, you're crashing your estrogen, you're also going to lose bone density via osteoclast, consuming up more than the blast can build back in the bone cells. So I'd suggest that if you're doing this, you have to do it with someone who's knowledgeable and isn't just kind of like throwing stuff at you that they heard was good, or just follows like suit to other, bro lore, I guess.
Yeah. That's where my mind goes to when you bring all this up. It's like, well, where do you go?
Yeah.
Because this is like, I mean, you got to be on top of it. You can't just grab some cream and do labs, once a year. It seems like something you got to monitor.
It's definitely something I think at first, if you decide that this is right for you, and at first I would say labs I would not do it without, personally, I wouldn't do it without them. You can tailor the labs to what you want specifically, which I would say once you do whatever lab panel you want and figure out your numbers, within 3 months, I would do another one specifically with total testosterone, free testosterone, sex hormone binding globulin, and albumin, and estradiol, E2, which is there's 3 types of estrogens. Estradiol is like that's like all the power of estrogen pretty much. So I would do those if you are deciding to get on it, and then do any labs. Those are the ones I would do, like within 3 weeks, or excuse me, 3 months. And then from there, depending on what your provider suggests, depending on what you want, like have the conversation. But once you figure out your protocol and everything, I'd say it's still good to do like every 6 months for
Yeah.
sure. Like it's not something you just do a panel once and then you send it and hope for the best, because it is changing things.
Yeah. So other than Dr. Grant's one place to go, is there any others you recommend?
I haven't used any, so
Yeah.
it's hard for me to say.
Yeah.
For my initial blood panels and just like honestly educating myself, I used Marek, and I appreciated that they didn't push anything. So it was 4 or 5 years ago, so I can't say what's changed, but I would imagine they haven't drastically changed that
Yeah.
ethics of their process. But yeah. Other than that, I would say don't go to the cheapest clinic. Like you have to consider, if you're finding something that's like testosterone or TRT only $99 a month, I could assume that clinic is not doing the best labs, and they're not doing the best consultation with you, and they're probably giving you a very low quality testosterone, which is important because like carrier oils are in testosterone, and a lot of them that are cheap, all of them I would say that are cheap are probably seed oils. So they use soybean oil as a carrier versus a higher quality is going to be an MCT or coconut oil. And this is a topic I was talking to a provider about, and he said that he saw more effects on men that they didn't like, negative effects using a carrier oil of soybean oil. So acne, rash at the site, the viscosity of the oil itself is thicker. So you get what's called lumping. If you're doing like a sub-Q injection, uh, you'll have just like a lump sitting there, and it's painful and itchy. And so he would switch, he'd get patients that come to him that are already on it and they want to continue because they didn't like their whatever. And he would switch them immediately to a higher quality, obviously more expensive MCT carrier oil. So
That's just in people who are pinning it via injection.
Yeah.
That's not in cream.
Well, the cream, that's another important thing too, of like having a trusted compounding source, because if you're getting the cheapest cream, what's going into that, what's alongside of it, what's in the cream itself, could be just like lotion full of a bunch of chemicals, and you're putting that right on your nuts.
What's a compounding source? Like do you have an example?
There's
Like,
Brigham started his own, Brigham Bueller with Wasewell. He has one called Revive RX, and that's like the compounding pharmacy he started. So it would just depend on, if you're going to a higher quality clinic, more likely than not, they're using a trusted pharmacy to get their products. Like usually they work in conjunction, right? I would hope, this isn't going to be everybody, but you could just find random compounding pharmacies, providers, if they want the quick, buck, random compounding pharmacy, getting the cheapest version or whatever, or you go with like, communicate, talk to, make sure you're doing the right thing and getting the right product that you want to give to your patients. So,
got it.
So yeah, it's all, I would say, important. And then understanding panels matter too. That's another thing, that some of the cheaper clinics will do a cheaper panel, and that means you're not getting the sensitivity you would need. So liquid chromatometry, mass spectrometry is like the go-to sensitive, ultra sensitive test versus an immunoassay or ELISA, which is like I was looking at one panel and they accidentally did both. So they did the LCMS and the immunoassay, and there was a 50% difference in the two numbers for estradiol. So it's important to use the higher sensitivity test, especially if you're trying to get a honed in regimen for dosing. You know, I mean, especially in women, because like if you're if there's a 50% difference, if their testosterone reads 50 nanograms per deciliter on the LCMS and it's 100, or vice versa, if it's 50 on the immunoassay and 100 on the LCMS or something, like they're going to look at the lower number and be like, oh, we need to bump this up, which is, you know, women are very sensitive to high levels of testosterone. So it would be important to know exactly what's in there, right? So even the testing, the blood panels matter. And that's why I recommended the one I did to you, because I knew it was LCMS, which is going to give us the better picture of those hormones.
That was the Marek comprehensive one.
Yeah. Yep.
Gotta get them sponsored.
Yeah, man. I mean, there's a lot that goes into it, and I think it's important for people to educate and seriously, like, talk to someone that's knowledgeable on this stuff, because it should be the same with any medication. Like, if there's, like we were talking on previous, is like it should be a two-way conversation, not just like, hey, okay, sounds good, I want all that. And in today's world of influencing and social media and stuff, like all too often we find that influencers are doing this stuff because they heard that they're low T, or someone told them that they're low T because they're in like 300s, and they get on it at like a younger age, and then everyone kind of has FOMO and they're like, oh, I need to be on it. There's a lot of factors that go into it. Like if you're dieting and cutting and trying to reduce fat, it's going to increase cortisol, therefore decrease testosterone. So you might be in a low level. Also, the hypothalamus releases GnRH, which is then kind of the precursor. The hypothalamus is like your CEO that goes and talks to the pituitary. Pituitary is like the manager and sends out the email of hormones that need to go out. So hypothalamus sends out GnRH, gonadotropin releasing hormone, in a like diurnal rhythm. So it's like a pulsatile thing. And that's why you typically get tested in the morning for testosterone, because that's when it's kind of the highest. It's when it's pulsing. But that's not always the case. Like you could be, I've done panels like a couple months apart, but it would be, I mean, there might be even a difference between 1 week if you hit that pulse at the right or wrong time. There's a lot of stuff that goes into it. So generally, your level is pretty much what it is if you do it in the morning. But if you're doing all these other things like cutting and or not sleeping or drinking or these things, like you might have a way lower reading that day than you would in general.
Yeah.
So
I can remember I did a panel and I drank the night before. I had 3 glasses of wine and my levels were super low. And then I did another one, I think it was a few months later, and they were relatively back in range.
yeah.
And it was like, I didn't do it intentionally, but I got the second test because I'm like, I had a few drinks the night before, and let's see what a week or 2 weeks, can't remember how long I didn't drink. I kind of optimized everything, and yeah, it was totally different.
Yeah, sleep will definitely affect it. And that's why I hear a lot of people say like circadian rhythm and all that plays a secondary factor to testosterone for sure. I don't want to overlook that, but it's not something to just be like, oh, I have low T, I need to get on TRT.
Yeah.
Because like,
Gosh,
if you're
that muddies it though too.
Yeah.
Where it's just like you basing a decision on one panel.
Mm-hmm.
I feel like it's got to be well thought out. Like you've done all the things like you mentioned, limiting or cutting out alcohol, dialing in the diet, sleep, and then just like realizing like how low your energy is or libido. Like that all has to be done over time
Mm-hmm.
before basing it off one test result, I feel like.
Well, that's why I like the idea of like the foundational test, right? So you get that, and maybe a couple months later, you get another one just specifically to hormones. That would be good. But I will say too, like, I don't want to say all that and then say like panels don't have a place, because majority of the time, well, they should be pulling like free testosterone. They should be pulling the sex hormone binding globulin and albumin. And the reason they should is because those numbers are going to help show too, like levels. So like your total is going to be nanograms per deciliter, which is typically what they say, like in between 300 and 1,000. And then free testosterone is essentially a percentage of that that's unbound to SHGB and albumin, which are both carriers, I guess, of hormones and different things from the liver. And sex hormone binding globulin specifically binds way tighter. So you could consider that that's just like, it's essentially regulating hormones in the body, so it's not just going haywire, right? If you just had hormones going everywhere, that would not be good. So sex hormone binding globulin binds to it and is kind of like the doorman, right? If you increase or decrease that, that's going to free up free testosterone, which is the percentage of what total testosterone would be in your blood. And then albumin is essentially the taxi of those hormones. So it's loosely bound. And I don't think a lot of people consider that some of that is going to the cells, like shuttle to the cells, and it's actually being used. So to say free testosterone is the only number you need to look at, I disagree. There's more factors at play. And you use the other reason why I say get those panels is because you can use the Vermilion formula, which just type in T calculator in Google, it'll pop up. And then you type in total test, free test, SHGB, and albumin numbers off your panel, and it'll give you the percentage of free testosterone, or it'll give you like the amount in nanograms per deciliter of free testosterone that you have floating. So, and that's just essentially the bioavailable testosterone in your blood. So,
got it.
Yeah. But yeah, that's why, I mean, it's important to not just base it off one thing and have people that are truly in the space, not pushing something.
Right.
Too.
Yeah.
Like, yeah.
Good stuff, man. Learned a lot today.
That's good. That's good. I'm trying to see if there's anything else that, I mean, I will say too, the T booster supplements, like Tonkat and Shijijat and ashwagandha and stuff, do have a correlation with, well, Tonkat's more a correlation with SHGB. It reduces that, freeing up more testosterone, but it's not going to be like a needle mover if you're paying $90 a month for this T booster. I would say the average jamoke like you and me is not going to see a difference in like all these effects. But placebo works 30 to up to 60% of the time in some trials. So add that on there. Maybe you are making a huge difference in order to get your life into gear. But like ashwagandha is more indirect, where it's reducing cortisol and stress, therefore increasing the ability to make more testosterone, and not desensitizing Leydig cells. And there's a lot of factors too that reduce testosterone, I think, that are underlooked, alcohol being one. If you do it, moderation, or just don't. Sleep's good, so don't be scrolling the gram at odd hours of the night. And oddly enough, I wrote a blog about this, but ibuprofen, or NSAIDs, had a huge effect on men and women in fertility, specifically in men on lowering testosterone only after 14 days, and desensitized Leydig cells, causing compensated hypogonadism. So the body's raising LH and lowering the LH to testosterone ratios were way off. So the body's saying, I need more testosterone. Let me pump out, pituitary's pumping out more LH. but the Leydig cells are kind of desensitized, so it's not producing as much testosterone from the LH, causing significant drops in testosterone only after 14 days. And they did this study for 6 weeks. So
Wow. Was it 400 milligrams?
it was 1,200, which sounds like a lot, but typically a typical dose, that's like the typical dose they give. That's twice a day, right? If you're taking a ibuprofen or, other NSAIDs are even stronger than, 200 to 400 milligrams. But if you got a 400 milligram NSAID, you take that when you wake up because you're in pain. You take it at lunch because that pain won't go away, and then you take it before bed so you can sleep. There's 1,200 right there, and that's what they were doing with the study.
Wow.
So
it's crazy.
Yeah, so that one is one to consider, along with a bunch of other side effects from NSAIDs. So I'm not huge on those unless absolutely if needed. But yeah, man, it's definitely an interesting topic. I want people to be educated as much as they can be, and or enough to be making a correct decision on who they want to speak to about it, how they want to go about it, and if it's truly like going to benefit their life at that time, or, don't have FOMO on like you need it. If you're at 300, dude, my test levels last time I got tested were like 290 something. I feel all right. I don't look like I need it. I'm not having a problem with muscle protein synthesis. And obviously there's, there's a lot more to it than that, but I don't think people should just be like, oh, I need it. Especially at our age. Some people do, hypogonadal. But I do see a benefit for it, and I more likely than not will consider it in future years. So yeah, just like make the right decisions based off of what's best for you. And if you decide yes, get the correct team behind you that's for you, not for the money. So
well said.
Yeah. All right, man. What else you got? Anything else? Call it a wrap.
Wrap it.
All right.
Give me some Cialis.